So, welcome to our mental health holiday survival guide. Doctor, thanks for being with us. Introduce yourself, please.
Yeah, pleasure to be here with you, Stephanie. I'm Dr. Philip Izzo. I'm the medical director of Miramont Outpatient Centers, which is part of Mainline Health.
Great, thanks for joining us today. So, they say it's supposed to be the happiest time of year, but statistics show that's not always the case. Give us an overview of what people are going through mentally during the holiday season.
Uh, I mean, a broad-based kind of, to use one word, I suppose, is stress. I mean, honestly, it's a very joyous time. It's a time that we get to celebrate with family and, children, loved ones, things like that. But it's also a time where we place a tremendous amount of stress on ourselves. So, we all have visions of a perfect holiday season and how it's supposed to go. And a lot of that entails doing more things than we would ordinarily do, which has the capacity to strain us to some extent.
What are some of the tips that help people get through the holiday stress?
So I've I've talked about this topic for several years in a row now, so I'm kind of used to discussing it. But that's a good thing for you and your audience. And what I would say first and foremost is well, two things. Number one, understanding where your limits are, understanding when you're feeling stressed, when you're feeling overwhelmed, when you need to kind of be able to take a break. And then bridging off of that, I would say, is being able to give yourself the grace and the leniency to be able to say, like, I'm biting off a little bit more than I can chew right now. And maybe I need to take a step back. And even though it's not going to be as quote unquote perfect as I would want it to be, it's going to be good enough. And honestly, I'm going to have the people there that are important to me, and that's going to suffice. So,
Family dynamics can be complicated. What are some of the things that you tell people of how to kind of get through complicated family dynamics during the holiday without causing any upset?
that's putting it lightly, Stephanie. Family dynamics can be very complicated. So yeah, I mean, I have a number of patients who have complicated family tapestries and dynamics where, they have maybe longstanding feuds or disagreements with certain family members, differing political opinions, things of that nature. And usually what I would counsel them to do is that this is a time to kind of put some of that stuff aside. This is a time where you're not going to convince your 80-year-old uncle that, he should or should not support a political candidate. This is a time to really just focus on being with your family, enjoying that time, talking about maybe more superficial or, non-dense issues and just enjoying the time together, I would say.
And I think also dealing with stress, family dynamics, all of that, I think being well rested, even though that can be hard to do, and kind of stick to your routines of exercising and eating, because it's easy to get out of that. So explain why those sorts of things are so important to kind of help us get through the season, mentally anyway, in a good way.
Sleep is one of the most important things I ask of literally every patient that I see, in our clinics. So I always ask about sleep, and there's a reason for that. It's because it's so important to mental health. So making sure that you are getting enough sleep. I understand there are circumstances and times you have a busy household, maybe you're wrapping presents. There's going to be a day or two where maybe you kind of sacrifice a little bit of sleep. But if that's getting into problematic patterns where you're noticing that you're losing sleep for multiple days or weeks at a time, then that's probably a time to hit the pause button a little bit, take a step back and say, what could I and what should I be doing differently to kind of give myself a little bit more leniency and take care of myself a little bit more. So,
Exactly. Let's talk for a moment about people who struggle with things like depression or anxiety. Lots of people struggle with lots of different mental health issues, and the holiday season is probably difficult and tricky for those suffering and for those who love them. So give us a little bit of insight into that.
Yeah, I would say two things about that. So, number one is there absolutely is a seasonal component to some people's depression. So there's actually a given diagnosis for it. It's seasonal affective disorder, where you get a little bit more depressed around the time. It usually occurs around daylight savings time. We lose more daytime light hours, and that can be combated by consulting with your, medical professional, therapist, psychiatrist. Maybe you need kind of some some different interventions in there from those perspectives, or even some patients I'll speak to about light boxes, where there's some studies to suggest that light box therapy can be helpful in improving seasonal affective disorder. A second topic that I think is really important to acknowledge for your audience here is that the holidays are typically a time of reminders for people. It's a time to take stock in what has been gained and lost over the course of the last year. And for a lot of people, sometimes what's entailed in that is they're taking stock of the fact that they've lost a loved one. And this is the first holiday that they're celebrating without said loved one. And, that could be a particularly jarring period of time, particularly if that person is a parent, a spouse of many years. It's a complete departure from how they're accustomed to celebrating the holiday season. And being able to acknowledge that, with other family and friends, make some plans to be sociable with other family and friends around the holidays. I think very important to be able to kind of protect yourself. So.
And for people with depression and anxiety and other issues, those who are on medication or doing other things, I suppose it's especially important to stick with the routine of what you do and not be sidetracked by holiday parties and gatherings, travel, all that sort of thing.
I mean, yes and no. I think that's a very individually based and depends on the person. I mean, honestly, I have many patients who I see for depression and anxiety related issues who they're managing their condition particularly well. They actually take great joy, in attending some of these kind of holidays and parties, and something that they look forward to all year. I would not want to deprive them of that, and actually maybe even with some of these patients, deprivation of that could be concerning to me of some worsening of their depression and anxiety. But for others, I mean, these are obligations that they feel like they need to fulfill, and it adds more stress and more complications to their day-to-day life. And that's where I think really kind of taking stock of things, taking stock of, what do you look forward to in the holiday season? What are your priorities? Like, what do you have time for? A lot of these things are really important in kind of being able to assess what's important and what's not of the holiday season. So.
And in terms of what's important and what's not, it's a materialistic world we live in. The economy is tough for people. Remind people about, it's not necessarily about, the best gift or the most expensive or dinners or all of that. It's really the focus should be on togetherness, family, the season. Talk about that a little bit, the economics of the season and how that fits into mental health.
You said it all right there, Stephanie. I mean, just to reiterate and kind of provide some more examples surrounding that. I mean, when I was in training, one of my former training supervisors kind of would tell me a story about how his family has forgone any kind of gift giving around the holidays. They just spend time with each other. That actually, he felt as if that took a tremendous amount of stress away from everybody involved, because they didn't have to go shopping for the perfect present. They didn't have to spend money that they didn't really need to have. And everyone was just much more satisfied around the holidays. And being able to kind of acknowledge and appreciate that with loved ones. I mean, for me personally, I can tell you that I have a few nieces and nephews and children of my own, and my siblings and I years ago have decided we're not exchanging gifts amongst each other and just giving to the kids, and we're happier for it because we spend less time doing that, less kind of involved in shopping, spending money we don't have, and being able to take stock of that and appreciate what's going to be stressful and what's really the important parts of the holiday season is very important.
Yeah, I think taking a moment to be grateful about something. We get lost kind of in the shuffle sometimes, and the holidays are a good reminder that we should take a moment and think about that.
I mean, there's the old adage of like New Year's resolutions, and people kind of it's a time where people really do take stock of how satisfied am I with my life? What are things that I want to make changes with? And like how realistic is that? And that can be a bit of a rabbit hole too, because sometimes people bite off more than they can chew, but I definitely do think it is a time where we kind of look at the year that has passed and say these are things that I'm proud of, and these are things that I'd like to improve upon. And I don't think there's anything wrong with that. I actually think that can be extremely healthy. But being able to work that within, what's the word I'm looking for? Being able to work that within paradigms in which you feel comfortable and not overly exerted or stressed out is an equally important part of taking stock in those issues.
Exactly. Well, here's to wishing you a happy holiday season. I appreciate your time and help, and cheers to 2024. Can you believe it?
Yeah, no, cheers to you too, Stephanie. We've seen a lot of
Thanks.
each other this year, and I appreciate it.
I
So it's one
appreciate
of the
your
things
help.
I'm appreciative of, Stephanie.
And
So.
me of you the same. I appreciate it. So thanks again for being with us and helping us get through our holiday mental health survival guide. Take care, doctor.